because they are far less broken and use far less primitive defense strategies, therapy can reach them. Whereas the pathological narcissist, the person with the personality disorder, the level at which they're broken, the psychotherapy can't get past that. It is the brain, the mind is permanently malfunctioning and it can't get back online. You can't become empathetic if that part was destroyed early in your attachment experience.
I have a different perspective on it, obviously, because I work with these individuals, but well, there's a lot of research out there, you know, for these groups like mentalization-based treatment. You've heard of transference-focused psychotherapy, Kernberg and his group. They predominantly work with people who are considered at the borderline level of organization, but because there's so much overlap between narcissist and borderline, inevitably they have these people in their studies as well.
Right. There is a difference prognostically. Someone with BPD has a higher prognosis, a higher ability to benefit from therapy, albeit low, than people with narcissistic personality disorder.
Hello everyone, welcome to the Narcissism Decoder. I'm your host, Dr. Anthony Mazzella. This is part 2 of my conversation with Ross Rosenberg, psychotherapist, educator, and author of The Human Magnet Syndrome and The Codependency Revolution. In this second part, we shift more directly into the relational dynamic, why opposites, the, and I quote, giver and the taker are drawn to each other, and how that pattern gets repeated. I also ask Ross more specifically about his treatment approach and what it actually looks like to begin working through these patterns in therapy. And as you'll hear, there's a moment where the conversation begins to open up into a bit of tension around the question of treatment, which is not uncommon. If you've been listening to this podcast, you know sometimes when I talk about treating narcissistic personality, it gets tense. And we have to think about what's actually possible in terms of treatment and for whom. If you stay with me through the end, I'll come back and offer some of my own reflections on this part of our conversation and how I think about working with narcissistic dynamics clinically. I'm going to take you right into our conversation at the point where Ross is beginning to talk about this, and I quote unquote, dance between opposites, what he refers to as the codependent and the narcissist, and how these patterns take shape in relationships.
The caregiver needs the caretaker, while the giver needs the taker. The patient needs the inpatient. It's the dance, like a tango. The two opposites fit together. And so narcissists, codependents fit together. And so if you accept that theory, then you understand that the codependent has to find a way to see whatever's happening with the narcissist as love so that they can feel loved, just like the narcissist has to find a way to see the codependent as love. And so that they are often at the brunt of the narcissist's harm. But because of their codependency, they see that within this larger context of love, a larger context of commitment, and they don't have enough self-love to understand how badly they're treated. So within this relational dynamic, the narcissist gets to act out to a person, the perfect type of person that's not going to leave them, that's not going to fight back. That's why a narcissist does not fall in love with a narcissist. It doesn't work out. So we think of magnets, the opposite North and the South Pole, they come together.
So who do they fall? Just go over this. This is very interesting. They fall in love or they attract, what did you say, the codependent or what was it?
Yeah.
What was the word
Narcissists naturally fall in love with codependents because it's the only personality type that inversely matches up with theirs. They're entitled, self-centered. Only person that's going to match up with them is someone who is invisible, who doesn't really have self-esteem, that's not secure, that is giving and patient. It's the opposite personalities allow them to coexist. So when we look at a narcissist codependent relationship, the codependent is weak. They're invisible. They're voiceless. They're often the subject to the narcissist's injuries, rage, projection, gaslighting, and they stay there. And that's my job. That's what I do is I work with the victims of this and they experience it as love. And within that,
because they're getting something, Ross, is that right? Like they get something out of the relationship, which is what? Like what keeps them there?
Well,
do they feel seen at the moment? You know, when the narcissist is, let's say, idealizing them or what they call love bombing, whatever phrase you want to use, but do they feel recognized?
Well, this goes to the concept of trauma bonding. Trauma bonding is this connection of familiarity that this feels right. This is what I know. So the SLD growing up, the codependent grows up feeling like if I am just accommodating enough, invisible enough, giving enough, patient enough, a person will like me.
Yes.
And that is the trauma of their childhood, is they had to disappear in order to manage the relationship with the narcissist. And the narcissist could not get a relationship with the parent. They couldn't manage it. They were the recipient of the narcissistic parent's narcissistic injuries, neglect and hurt. So we look at these two individuals, adults, the narcissist and the codependent. Their childhood traumas are interacting. The codependent finds the narcissist is familiar. It's what they know. It's what they know how to do. They know, walking in their sleep with their eyes closed, how to love someone who is harmful to them. But they have no idea of how to love someone who is good to them, who is respectful. They have no experience. That is familiarity. The two find each other. The narcissist finds someone that listens to them, that gives them this wide breadth of respect, love, and appreciation where no one else is. The codependent narcissists, like the tango dancers, they fit, and it fits because of their early childhood experience of attachment. In essence, is the trauma bond. The trauma bonding keeps them together. They don't really know about it. It's unconscious, but they both are getting their needs met. They don't want to be alone. They're scared to death of being lonely, and they stay together because that's what they feel that they deserve and what fits their life experience.
Okay, this is great. I really appreciate this. And it leads into one thing that we didn't get into yet, but this could be a big segue into. We've already talked quite a bit about narcissistic vulnerability, the shame, and the rage, right? The compensatory rage because of the grandiose structure is threatened. But what we haven't spoken about, and you're getting very close to it now, is what makes treatment possible. So we don't have to look at it, Ross, like in terms of the narcissist and the rage, which of course we can, but you just mentioned that you work with the other side, which is the codependent, right? So you probably have more experience. I work specifically with, I work with both sides, quite honestly, but I'm curious in terms of treatment, what does that look like? Because this kind of relationship you're describing, you said this is the only love that they know, right? And could they tolerate a different type of love? What does even a different type of love mean to them? And what would it do to them, in other words? So all that is to say, what in terms of how do you think about treatment? And you could go either way, with the narcissist or the codependent.
Well, I will. But the love is broken to an outsider. It's dysfunctional. But to an insider, it is the interaction of what I call relationship templates. Relationship template is predictions for yourself, your preferences, your comfort level with someone in a relationship. And that is guided by early childhood experiences. So if you were lucky and had normal parents who were neither a narcissist or a codependent, just say normal, dysfunctional, regular people, you would have had attachment. You would have had unconditional love. And so your relationship template would be you're attracted to a person that respects you. And so when you meet, the chemistry comes together and you are attracted to the people that respect you. And that's chemistry. And you fall in love. And that's how the human magnet syndrome works. So with the codependent and the narcissist, their relationship template is, as I said earlier, the codependent is they know all about love when they push down their needs. They become invisible. They take care of someone. They're patient. That is their life experience. The narcissist, all they know about love is for them being front and center and being the most important part of it.
Yes.
That is their mindset. That when the two meet, there is this connection, this chemistry, and this love. What my father once said, what starts off as a soulmate ends up as a cellmate. To the question of treatment.
The soulmate is what starts off as a fantasy, an idealization, right? A blissful union turns into, that's the trauma bond again, the cellmate. Is that right?
They both, And so what that really means is they both start to resent each other and get angry. But these relationships don't break up. The only person it remains somewhat positive for is the narcissist, because they tend, based upon the relationship dynamic and unique personality type, they tend to get a lot more than the codependent does.
This goes back to the question I raised earlier. What keeps the codependent there? Because
they
stay. Yes.
So both of them have attachment trauma. Both of them have core shame and what I call deep pathological loneliness. But the difference of the trauma and the core shame from the child who was not loved by the narcissist is different from the trauma and the core shame of the child that had to abandon their real self to be the lovable object. Both were trauma, but they were different levels of trauma. the child who didn't get anything, that trauma is exponentially bigger. It's so profound. But they both develop this idea of what they believe relationships look like. And when they meet, it feels, codependents and narcissists, when they meet, they don't fall in love with each other because the other one is dysfunctional. They fall in love because of all these positive things, whether it's anticipation, fantasy, but it eventually does not hold up because they both are trying to avoid loneliness. So we look at core attachment trauma. I have a pyramid. Attachment trauma, core shame, loneliness. Both are terrified of loneliness. Both cannot stand loneliness. And you can talk to any SLD or codependent or any narcissist, and they will say the experience of not being in a relationship is excruciating. That pain drives them into a relationship quickly. So why don't they get out? Well, the codependent, first of all, believes it's love, going back to the relationship template. And they also believe that they're not fundamentally lovable, going back to the shame. And they are absolutely terrified of being alone. That's why I call it pathological loneliness. Both are terrified by pathological loneliness, and it keeps them in a relationship. It's like electrical charge. If they get too close to it, it shocks them and it hurts.
Your work then with the codependent is to do what? To gradually help them recognize? Do you work like through insight? Is it through enactments with you in the room?
So let me first say that according to research, people with personality disorders, such as narcissistic personality disorder, there's a very small amount of people that have successful outcomes in psychotherapy. One can say less than 4%. Some people say it's lower than that they don't respond to mental health services or psychotherapy because a personality disorder has created a broken structure in their mind. They can't get past what they fall prey to is this narcissistic belief system. They can't get to empathy. They can't get to forgiveness. They can't get to acceptance. They are so broken that psychotherapy often doesn't work. And if it does, it takes years. So, but with the codependent or the person with self-love deficit disorder, again, we're looking at the difference of attachment trauma. I would guess that the attachment trauma is 3 to 5 times more severe for the child who becomes a narcissist. So the person who's a codependent, it was traumatic, but their psychology, their mind was not broken. It was injured. And because of that, they can respond to psychotherapy. They do not disappear into the unconscious. They have access to memories. They have insight. They have empathy. Because they are far less broken and use far less primitive defense strategies, therapy can reach them. Whereas the pathological narcissist, the person with the personality disorder, the level at which they're broken, the psychotherapy can't get past that. It is the brain, the mind is permanently malfunctioning and it can't get back online. You can't become empathetic if that part was destroyed early in your attachment experience.
I have a different perspective on it, obviously, because I work with these individuals, but well, there's a lot of research out there, for these groups like mentalization-based treatment. You've heard of transference-focused psychotherapy, Kernberg and his group. They predominantly work with people who are considered at the borderline level of organization, but because there's so much overlap between narcissist and borderline, inevitably they have these people in their studies as well.
Right. There is a difference prognostically. Someone with BPD has a higher prognosis, a higher ability to benefit from therapy, albeit low, than people with narcissistic personality disorder.
So what both of these groups have done over time is they've adjusted their protocol to specifically work with narcissistically disturbed patients because they were seeing them anyway, and they realized they need a special treatment protocol for these individuals. Now, in terms of change, yes, of course, change is possible with these individuals, but you have to think about how do you measure change? What are your outcome variables?
Exactly.
Yeah, so in terms of empathy, I know I hear this one all the time, Ross, but that's the whole mentalization approach. Increasing mentalization, which is well documented, is the capacity to do what? Think and reflect on one's own thoughts and feelings and the thoughts, feelings, and behaviors of another person.
Yeah. And to be sympathetic, that's empathy. If it's not sympathetic, it's sociopathic. So if you can figure out how people feel because of what you're doing and you don't have compassion or empathy, then we're looking at the sociopathic elements of the disorder, I think.
Okay, well, we won't go down this rabbit hole. This is a whole nother discussion because this has been a fascinating conversation. And what I really appreciate about your work is we said we started with rage, but then we looked a little bit beneath the surface, right? We looked at vulnerability, narcissistic slights. So we looked at what goes on psychologically, and that's what I appreciated about this conversation. So I wanted to thank you for taking the time to come in and really enlighten my audience on some of the nuances of this.
Oh, it's my pleasure. I love these conversations.
Ross takes a pretty clear position on treatment. He draws a sharp line between what he sees as a more rigid, and I quote, unreachable narcissistic structure, and the codependent, who he views as more intact and therefore more responsive to therapy. From a psychodynamic perspective, that's a strong, and I would say debatable, stance. As I began to suggest in the interview, models like transference-focused psychotherapy and mentalization-based treatment offer a different way of thinking about this. They don't assume that the mind is simply too broken, but instead focus on developing capacities that are impaired, especially the ability to mentalize, to reflect on one's own and others' internal states, as again, you may have heard me start to mention in that dialogue that Ross and I were having. You can hear the tension in that moment where the conversation shifts towards sympathy, almost a more cognitive ability to read others, according to Ross. But the deeper question is whether someone can actually experience and reflect on those emotional states in a more integrated way, not just recognize them from the outside. So really, what's underneath this discussion is about what we believe is possible in treatment. Is the narcissistic structure fundamentally closed off? In my own clinical experience, and what is now a large body of case literature, developing reflective capacity and integrating split-off aspects of the self is possible. And I've tried to illustrate that here with prototypical examples on this actual podcast. That said, effective treatment, of course, takes time. These are personality disorders, which means these are things that are deeply ingrained. They're not simple symptoms. The work of psychodynamic therapy is slow. It involves ruptures, defenses, and moments where reflection disappears entirely. But it's also important to note, and even Ross alludes to this in part 1, that there are moments, and you hear me talk about this quite a bit. This is so important that there are moments, sometimes I even call them micro moments, but there are moments when the door to vulnerability does open, even if only briefly, such as in the context of a narcissistic injury. So, in my own experience, it's simply not accurate to say that the narcissistic mind is always unreachable. It requires a very specific kind of treatment, one that can recognize when that door opens, help it stay open a bit longer, and also survive the very defenses, that's the closing down, the stone wall, right, that shuts you out, but also shuts off their emotional life. But the point is also to survive the very defenses that inevitably close that door again. If this spoke to you and you're curious to learn more about all issues related to narcissism, please support the show by subscribing so you don't miss what's coming next. And even more importantly, take a moment to leave a review. Reviews make the podcast easier for others to find, which helps the show grow. The more the show grows, the more I can invest in creating thoughtful content that supports you in understanding and navigating your experiences with narcissism. Okay, thanks for being here with me. I'm grateful we got to explore this one together. Until next time, take care of yourself. Bye for now. Disclaimer alert. The Narcissism Decoder podcast is provided for general information purposes only. The content presented in this podcast is not intended to diagnose, treat, or cure any psychological condition related to narcissism. The content on this podcast should not be considered a substitute for professional medical advice, diagnosis, or treatment. For specific advice pertaining to narcissism or any other psychological condition, you could reach me directly. I am an experienced mental health practitioner who is always taking on new patients. If you would just like a consultation, I can do that too.